I hope you all are doing well, my dear friends. The topic for today, which we are going to discuss, is a topic sometimes people ask about this yoga therapy. So, yoga therapy, like when you talk about this yoga therapy, so is there any therapy, whatever therapy we are going to use in a condition or in a treatment, that the therapy, when the term itself comes, it is about the healing, it is about the treatment, it is the concept which we are going to follow, the different practices which is coming from the different principles of the practice, whether it is yoga, whether it is physical therapy, whether it is massage therapy. So every and each one has their different concepts, their principles, which type of practices or which type of techniques which we are going to use. So sometimes people ask that when we talk about this yoga therapy, so yoga therapy is basically in which condition we have to practice or not. When we're talking about this therapy term, so it works from the basics. It works on the origin, the roots of the disease. So it's not like in emergency medicines, like in emergency other boosters, which works on the body, but that works for the very slow duration, very short duration of the time. So in this yoga therapy, when the term comes, in which condition we have to practice, the do's and don'ts. So yoga therapy, when it comes, so we have to practice or we have to use the practices like asanas, pranayama, different breathing exercises, meditation, and other techniques and other relaxative techniques to work for the remedy to the problems. So this practices, when we use in the activity of daily living, it's not one day we do and then stop. Because when the thing works on the basics, on the roots, it takes a little bit time to settle down on your body. To take them slowly you can absorb or you can grab. So for yoga therapy, we have to use the different practices of the yoga, but this practices is not what you are using with a normal individual. Maybe the asanas has to be modified with the problems, with the disabilities, with the limited range of motions. Maybe we have to change some breathing techniques, we have to modify breathing pattern. So we don't have to go with the same pattern which is written in the book or what we have practiced with the normal individual. So in the therapy, you have to use so many things, you have to combine the things and give them as a one protocol. So it's not only the client is practicing with you. The client, you have to give them some protocol for their home, for their self-practice. So then it can be maintained a balance. Otherwise, the client is doing with you in the class. After that, he goes back to the home. Again, the same work, the same nature, the same stress, if it comes, and there is no remedy in between to balance, then whatever we did in the class, everything becomes zero, my dear friends. So yoga therapy has a beautiful practices, has a beautiful effects also, because it works on your physical health, emotional health, and the mental health. So it brings the balance and without any medications. Just what you need, your body and your mat, a little bit space. So that yoga therapy also works nowadays, as the researchers has proved. It is a basic therapy which is working on more the psychosomatic diseases, which is increasing nowadays in a very rapid order. In a very rapid manner, these all psychosomatic imbalances comes to the most of the people in this world. As the stress, anxiety, depression, this gives birth to the other diseases nowadays. The stress which is we are carrying physically or mentally also. So guys, to enhance your power, to enhance your capacity, to enhance your endurance, to enhance the stability in your life, the yoga therapy work as a boon. nowadays. So yoga therapy is do's and don'ts. So when we work about or talk about this do's and don'ts, generally when we're talking about which type of problems, yoga you can work as a rehabilitation also, guys. But for that we need to know about the knowledge of anatomy and physiology. Any pre-existing condition about that, if we know, that will be good for us. So in the do's and don'ts, basically for stress, anxiety, depression, for gastric problems, musculoskeletal, for arthritis, pregnancy also we use some yoga as a therapy. So these are some common things in which we can use. But we talk about the stress, the different level of stress, like physical stress also sometime. So if you are doing some poses that opens your mind, brings some stability, steadiness. When the alertness comes back to you in the poses to the mat, when you try it, you feel more open and more stable, my dear friends. So in the stress, we can also use some breathing exercises which calms down your breath, which soothes your nervous system. So you feel more nerve relaxation over there, and central nervous system becomes more relaxed. In the anxiety, also we can use the poses. Meditations are good. Some static meditation which we can use to bring the alertness, awareness back to yourself and get away from that anxiety disorders. In the depression, which we can use, like if the person is taking some drugs, then you might have to consult with the doctor that the yoga poses, yoga breathing exercises are allowed for him or her or not. So do note about that, guys. If there is any particular form of drugs which the person is taking, so sometimes there's a bouts of depression comes. Right? Some bouts of depression comes, so that time you have a difficulty to control to your students, and maybe sometime it triggers out more depression with the poses and by forcing to get the practice involved in your activity of daily living. The gastric problems which we can use because of the sitting jobs, you have a stress on your upper abdominal area, some tenderness, and due to hectic lifestyle and food imbalances. So the poses, some breathing exercises, some meditations, some cleansing techniques that helps to clear out this gastric problems too. In the musculoskeletal problems, your poses are the boon, are the best medicine which you can use for the musculoskeletal problems to strengthen your different category of poses, which you can use standing postures, forward bending postures, backward bending postures, twisting, inversions, shoulder stand, that you can use for the musculoskeletal problems. Plus breathing, when the breath has an alternate form there, and we are using it with the modifications, so it gives more oxygen to the muscles, then there will be less muscle cramps, less lactic acid formation, and more blood circulation flows everywhere in your muscles, right? So more blood circulation flows in everywhere your muscles, and the muscle becomes more healthy and happy. In the arthritis also, you can change that, you can maintain with certain poses with modifications, so it can maintain their normal range of motion and decrease the process of degeneration of your cartilage and other soft tissues. Same in the pregnancy, yoga work as a therapy, right? But you have to practice under the good guidance. If any complications during yoga practices you are seeing, just directly contact to your doctor. In the neck pain, back pain, we can use. But don'ts when it comes when there is any open spinal surgery. Right? Open spinal surgery, any fracture of vertebrae, any open heart surgery, and any implant, if there is any implant fixation in your bones, cancer patients, with chemotherapy, or any pathological disorder. So in any open spinal surgery, when it comes to this topic, guys, this is when there is any fixation on your vertebral column. Any nerve compression for the disc prolapse, sometimes we place some implants over there. So in that condition, until your client is not properly rehabbed by the surgery, by the process of inflammation, by the muscle control, we don't have to practice any kind of yoga poses. That time, a good guidance must needed by the physical therapist so that they can maintain their normal range of motion plus strength on these spinal muscles. Then we can use a gentle yoga poses as their strength, right? As to add more strength to the body, but with the prescription of the doctors. If there is any fracture of vertebrae, then also no need to take any kind of risk, whether implanted with some kind of implants or prosthesis over there. So we must have to avoid some yoga poses with this also. Any open heart surgery, heart transplantation, or any kind of imbalances with your heart reason or with the muscles or other soft tissues, we must have to be consult with the cardiologist or the prescription or the note that the person, she or she can do or not. So we could not take any risk on these conditions also. Any implant fixation on your bones, sometimes the fracture on the bones, so they put some rod over there, like sometimes they put the needles over there, nails over there. So maybe if we are putting too much and we don't have any knowledge about the weight bearing or the load bearing, how much we have to distribute on the limbs, maybe sometimes there is danger or the chances that it can be little bit can dislocate from their original place. So no need to force or push too much until we don't know about that particular condition. Cancer patients with chemotherapy, as you have seen that nowadays the cancer is growing like very rapid speed. What is the reason behind it? Is your stress. That is the root cause of most of the diseases, my dear friends. So with the chemotherapy, if it's going on, we can generally use some breathing exercises, but no need to force too much the patient with more aggravating postures, more dynamic poses that can bring and takes more energy from the body. Any pathological disorder is there, like any pathological disorder, like there is emphysema, right? There is a lung emphysema is there, or you have any kind of imbalance where pathological inflammation has to be affected. When the pathological inflammation is coming there, we have to avoid the yoga practices until we don't have any consultation with the doctors. So these are some conditions. Basically, if you talk about, if these conditions are properly rehabilitated, right? If we talk about this cancer, this is a different condition. If the rehabilitation is proper done, we have seen that students also who is practicing yoga too. But we must have to be avoid in the beginning until it is not rehabilitated or healed properly. So we could not force the student, we could not take the student with any grant notes of our side. But in these conditions, we can do, or most of the conditions, like sometimes you have a lower back pain, we use yoga poses, right? But that is general back pain, not any pathological inflammation. If it comes to the lower back pain, like any disc prolapse, disc herniation, so we must have to be little bit get aware with the consultation of our seniors. So that's what we all needed. So yoga basically, guys, this therapy, yoga therapy, work on the all diseases. But when there is any mechanical injuries there, we must have to avoid and get more confident about the things which we are teaching, and we have to take the second opinion with the supporting teachers, with our seniors, or with medical practitioners. So we don't have to take any risk on ourselves that you will be in the problem in the future. So yoga therapy is the combination of the practices which you can use, my dear friends. For the diseases who is surviving for the long time, the chronic diseases which is surviving in our life for the long time, if we are getting some practices of the poses, some relaxative techniques, some pranayamas, different pranayamas, right? Some cleansing techniques as we bring into our daily routine, some meditations which clean up our mind, and bring stability, attention towards yourself. So yoga is a preventive medicine. It's not any magic which can cure you in the one day. So it's not any black magic. It takes a time. The process is there, right? The progression is there. The protocol is there. So it's not only in the class. When we work on the yoga therapy, we need a regular follow-up. As you go to the doctor, you took the medicine, proper follow-up is there. This is your preventive medicine, right? There is no side effect with that. If you are practicing, and then if you are following a protocol in your home, right? If you are following a particular diet also with that, so that will be more beneficial for you. So till then, guys, be happy, be healthy, enjoy your day. Namaste.